All right, welcome back. If you are just tuning in, we are talking about endometriosis. It is Endometriosis Awareness Month. I am with Andrea, and we just discussed a little bit about what endometriosis is and really how it can affect different people in many different ways, some large, some small, but overall, it's a pretty painful diagnosis. And what my next question would be, Andrea, is really where does this all start for people? Where should they start be questioning? Maybe this isn't just a temporary thing, and what are some things to look out for?
Sure. So I'll just give you a few generalized symptoms. Again, everyone experiences it differently, and some folks don't even realize they have it until they start experiencing infertility. But some of the main sort of red flag symptoms are painful menstruation. And I don't mean just, a few cramps here and there. It's debilitating pain. I mean, your periods should not take you out of work. They shouldn't, have you missing out on your life. And a lot of misconceptions surrounding endometriosis is that, oh, this is normal. This is normal. This is a part of, being a menstruating human, when really, and it's because of the taboo surrounding menstruation, which absolutely needs to change. We need to be able to talk openly about it, because otherwise we're suffering in silence, and we can't be doing that any longer because we deserve treatment. But so painful menstruation, definitely. For myself, I experienced a lot of unexplained nausea. So a lot of GI symptoms. Like I said, it can be misdiagnosed as IBS at first. A lot of, pelvic pain, unexplained fatigue. Again, some people run into trouble getting pregnant if that's something that they're trying to do. Of course, there are a few different, reasons that could result in infertility, but endometriosis is one of them. But again, I mean, it's sort of a head to toe slew of symptoms for some people, but painful periods, painful menstruation, abdominal pain, even throughout the entire month. Myself personally, I get painful ovulation. Like I can tell when I'm ovulating because I'm in such pain. And then other times it just pops up randomly. So, but especially when I was younger, around 13 and a half, 14, I started having these debilitating symptoms, this overwhelming nausea, and no explanation for it. And it does tend to run in families as well. So if you're someone who has endometriosis and it's been confirmed, it is more likely for another relative to also have it. It's not guaranteed, but for myself, I have it, my mother has it, and her mother has it.
Yes.
So it's sort of this lineage that no one really wants to leave their child. But even just talking openly about symptoms within families is really important. Having access to healthcare providers who know what endometriosis is very important. Even at the elementary, middle school, high school nurses, they should be aware, because if these students are coming to them with massive pain, it's really important that they can sort of point them in the right direction and say, hey, this might be something that's going on. You might want to look into it.
And some things I'm thinking about, what I've learned from is this is as common as diabetes, and this is something of 1 in 200. Is that the correct statistic?
So about 200 million people worldwide. The 200 might be coming from how many specialists there are around the world, which is very few when you compare to how many people have it. The statistics that we have, and again, research needs to be a little more inclusive. The research that's out there right now is only studying women. And it's 1 in 10 women, when in reality, it doesn't only affect women. So that's the statistic that's available is 1 in 10. However, when you include everyone who is actually suffering, the statistic is far greater than that. But around the same amount of people who have diabetes, yet we don't hear about endometriosis because of that sort of stigma surrounding it, because for generations it's been viewed, historically as a female disorder or a gynecological problem, and oh, we can't talk about our periods and all of this stuff, when really it goes beyond that. It's a full body disorder and it can impact anyone.
Well, I appreciate you talking about it and sort of taking the stigma away from it. What I'm learning here and what we want to say is start talking about it when we're younger, making sure that this pain is a normal pain, not one that takes you out of your social life. And maybe some of the education needs to get to the school counselors and the school nurses younger. So, and we're going to talk about this diagnosis and how long sometimes getting to diagnosis, but knowing that pain in the abdomen, pain around menstruation, pain around ovulation, obviously after you're pubescent, that these are symptoms that you should look further into and not just say, oh, it's just because you're now a woman, right?
Yes,
And if the pain is really debilitating and having these other symptoms like nausea and taking you out of social activities, it should be looked at a little further with by a doctor, one of these specialists.
absolutely.
All right. Thank you, Andrea.
Thank you.